There were a couple of recent Cochrane collaborations that came out discussing the success or lack thereof of public health initiatives around obesity. Do you want to say a little bit about those and maybe also talk a little bit about the history of why, I mean, if I'm going to be blunt, if I'm going to extrapolate from what we've just said, one would say that public health efforts to curb obesity have been a failure. And the future of obesity management will be pharmacologic, not public health related. Is that a fair prediction?
I think it's a very reasonable prediction. I'm not sure it's one I will share completely. I would share the first part, that public health efforts to affect obesity in a meaningful way have thus far been singularly unimpressive.
Mm-hmm.
And we'll come back maybe a little bit to why and where that's going and where we should go with it. I do think that in the present, and even more so in the not too distant future, clinical management, including surgery and pharmaceuticals evermore, will be ever more powerful, safe, effective, and utilized. I don't think they will ever become the complete solution, and I don't think that there's no solution in public health, but I think we've got to approach it differently. So let's go back in time a little bit. When I started my career sort of as a real professional, basically, 1991, I come to New York, the New York Obesity Research Center at Columbia University and St. Luke's Roosevelt Hospital. It's the only federally or NIH-funded obesity research center at the time. It's the first. It's run by Xavier Pissigny, the legacy of Ted Van Italy. Across the park, you've got Jules Hirsch, Rudy Leibel, and that group at Rockefeller. And it wasn't at the level of of public interest that it is now, the topic of obesity. What you had is these very interdisciplinary groups: physiologists, geneticists, physicians, psychologists, statisticians, nutrition scientists, et cetera, all working together on these problems. Many had been working together for decades, very academic, but also clinical. And you had the powerhouses that were in that region. You had Mickey Stunkert over at UPenn, you had Marcy Greenwood and others at Vassar, and so forth. And if a young person like me made some foolish statement in a seminar about some aspect of physiology or medicine that showed that, given my training, I had no understanding of what the heck I was talking about, one more senior person would put me in my place, but in a very constructive way, and explain that I didn't know what I was talking about. And the statisticians would argue with the physiologists and so on. So you had a depth of knowledge and a real depth of expertise and an understanding. Then NHANES 3 data came out, and there was the sense of crisis and panic, public health.
That was what, 94?
It started to come out in the early 90s, the midpoint of it, like 90, 91, was just starting.
Tell folks what NHANES is and what the data showed.
This is the National Health and Nutrition Examination Survey. It was, at the time, only done every few years. So first there was something earlier in the 60s called NEFIS, I think, National Health and something else. Then they developed the National Health and Nutrition Examination Survey. They did 2 of them. And then the third one was done, I think, between 88 and 93, maybe. So I think the midpoint data they released around 91, if my memory is right. And people started using the word epidemic, and they saw what looked like a jump. Whether there's a real jump or not around the late 80s or in the 80s is actually not so clear. If you look at skin folds, you see less of a jump and you see the increase starting earlier. If you look just at BMI and you look at increase, it's been going up for hundreds of years. The data from the Nobel laureate Robert Fogel, who won it in economics, he's since deceased, but he's a terrific, generous guy. And he collected all these old data on, British naval cadets from the 18th century and French cadets and Civil War soldiers and recaptured slaves during the Civil War, and looked at these different groups. And you see that obesity levels in BMI have been increasing for centuries. But they clearly did seem to be an acceleration, and that caused a panic. And then you had probably the most powerful voice at the time in this domain was Kelly Brownell. Kelly had been a real devotee of Mickey Stunkard. He was one of Mickey Stunkard's proteges, mentorees. And he was a behavioral psychologist, still is a behavioral psychologist, doing behavioral treatment. As a grad student, I'd go to his lectures and learn the mechanics of how to do behavioral treatment, cognitive behavioral therapy for obesity.
Meaning CBT to help people eat less, eat less, exercise more,
and so on. And then he had a change I guess this would have been the very late 80s, early 90s. He shortly thereafter switched to Yale. He got a MacArthur Prize, the so-called Genius Award, and he started to look at maybe concerns about the negative effects of obesity. And he was one of the most powerful, not the first, but one of the most powerful voices to start raising questions about the effects of yo-yo dieting or weight cycling, going up and down. Are we doing more harm than good? Are we just building false hopes up for people because obesity treatment is useless? And that started to change. And then he morphed into, it's the environment. And he introduced, at least as far as to me, the phrase toxic environment. We live in a toxic environment. You can't drive down the street, he would say, without encountering a fast food restaurant. And so this is the problem. We need to stop the individual treatment. He sort of abandoned his roots. And so we need to go to the public health treatment. Many others were grasping that idea, inspired often by him, but others on their own. And the public health community rushed in. And the public health community...
And this was a community that was, up until that point, working on smoking or what types of...
Smoking, food safety...
Leaded gasoline.
All kinds of things like the sanitation, vaccination, so on. They rushed in, and I think there was a lot of sense of, this is simple. People eat too much, they don't exercise enough. Eating less is good. Eating more quote-unquote healthy food is good. There's something about some foods are considered healthy, some are not. And if you eat the healthy food, something magical will happen. More exercise, of course, without any real understanding of this. I've had public health people who said to me, one person wrote and said, well, I think if we got people to not walk with their iPhones, then they would walk a little faster and then they would expend more energy while they're walking across campus, and that will help with weight loss. And what do you think? And I thought, well, we're still going to cover the same distance. There's a nonlinear relationship between walking speed and energy expenditure, and the amount of energy is trivial, and et cetera, et cetera, et cetera. And I just thought nobody who understands movement science and energetics and kinetics would make such a statement. But if you're a public health person, and you just think, I just need clever ways of getting people to behave the way I already know they should behave, then you come up with ideas like that. That's where if you're embedded in a group of people, that doesn't happen, right? That wouldn't have happened at the New York Obesity Research Center. If I had said that in 1991, I would have been immediately educated by senior people who had been thinking about this.
So in other words, the public health field wasn't really able to self-police ideas that were not grounded in science.
That's right. One of the things that we're very proud of in our school, School of Public Health in Indiana University, Bloomington, is that we have a kinesiology department, as in exercise science. And we're only one of 4 schools in the United States, schools of public health, that have a named kinesiology department. Now, every school of public health studies physical activity. But studying physical activity and being an expert in exercise science are 2 completely different things. We have actual experts in exercise science who understand this, who treat it as a science and take it seriously. We're very proud of that, and they do great work. So we got a lot of nonsense rushing in the field. We got a lot of things that never would have, in the beginning, you wouldn't have predicted to work. But people tried them because they sounded good, they felt good, gave people a positive feeling. Vending machines, farmers markets, walking trails, without really saying, all right, let's really work this out. How many people are going to do it? If they do it, how much effect will it have? Will they compensate by eating more or less or moving more or less later? Those things weren't done. So we've got a whole couple of decades of lousy, uninformative research.